Fall is here, but it doesn't really feel very fall-like. But of course, when we get to this time of the year, you know that the cold and flu season is here. Dr. Kevin Smith with St. David's Children's Hospital is here to talk more about the current viruses and what we can kind of look forward to, I guess, for lack of a better term, in the fall flu season. Thanks for being here today.
Thank you for having me here, Brian.
Let's start with this. What kinds of bugs and viruses and illnesses are you all seeing currently?
Yeah, so a lot of parents are familiar with flu, COVID, RSV, but what we're seeing the most of this season is a virus called human rhinovirus. It's one of the many causes of the common cold, and it's not particularly more dangerous than any other. But it is the most common this season.
What are some symptoms? What are some things parents could look out for when you talk about all the different types of viruses? What kinds of things can a parent look out for?
Yeah, so I think, every child seems to have a runny nose this time of year, and that's okay. That's their body doing its job. The things that I look out for when I talk with parents is, are they staying hydrated, and are they having such a hard time breathing that we're worried they may need supplemental oxygen.
How do you know if somebody's hydrated? A young child, how do you know if that child is hydrated?
I love this topic. So in small children, we look at number of wet diapers because their body is so exquisitely in tune with its hydration that if they get a sense that they're not hydrated, they will stop making them.
Wow. Okay, let's talk about walking pneumonia. This is a term I've heard a lot. First of all, what is it? And are you seeing more cases of this walking pneumonia these days?
Yeah, walking pneumonia is named after mycoplasma pneumonia, and it was colloquially called walking because people weren't as seriously affected as classic pneumonia. So they would walk into the clinic.
What kind of symptoms are you seeing with this?
Cough, fever, shortness of breath.
All right, flu and COVID, they're not going anywhere, we know that. Are you seeing many cases of that? And how does a parent know if it's serious enough to go to the doctor with either of the viruses or really any illness that the kids may have?
Yeah, COVID and flu haven't been as common this year, at least yet. And I think a lot of that is due to warmer weather. But my guidance to parents is if you're worried about your child, I want you to check in with the pediatrician, urgent care, or even me in the ER.
It's always a good idea when in doubt, right, to go to the doctor or see your primary care physician at that point. Is it too late to get the vaccine? I know we're just almost to November now. Is it too late for a kid to get a vaccine?
I don't think so. I think there's very little downside to any of the vaccines, and there's only potential upside. I myself got my COVID and flu vaccine yesterday, and I was planning to do it the week before, but I had a cold then, and so like you're supposed to do, I waited.
All right, let's talk about the question a lot of parents, especially with young kids, are curious about. When a kid is sick, sniffly nose versus something more serious, what things should a parent really look out for when their children aren't feeling well?
Yes, a lot of parents, and we've all been trained to do this, are fixated on fever. Will the fever break if the fever gets too high? What we see in the data is actually the fever itself is not the most dangerous component. And so what I'm looking for in these children is, are they still interactive, running around, playful, interested in drinking, staying hydrated? And then how are they breathing? So we look a lot at children's bellies and chests, and do we see the belly pumping in and out of view? Do we see the ribs coming in and out of view? Do we see them really struggling? They're sitting up to breathe instead of laying flat. That child is way more uncomfortable than a child who is drinking juice running around an exam room.
Very good information, Dr. Kevin Smith with St. David's Children's Hospital. Thanks so much for coming in and sharing your expertise with us this afternoon.
My pleasure, Brian.
Great to have you here.